Hi, I'm Dr. Pham at Miracle Dental in Las Vegas. I have a lot of questions regarding dental bridge. So today I will be answering some of those common asked questions about this topic so we can all understand more about dental bridge. So when you converse with your dentist, at least you have some background knowledge to bring to their attentions. What is a dental bridge? Dental bridge is a dental restoration that dentists use to replace a missing tooth. Let's say you have this tooth, whether being pulled just recently or you have lost it many years ago. So a bridge is a prosthesis that looks like this. Okay, it's there to replace this missing tooth. So it bridge the gap by using the two teeth next door to anchor. So at the end, the dentist will cement this prosthesis in permanently. You don't have to take it out. So it's very convenient. It's very pretty looking. It looks just like your original teeth and you can chew with them. So it's a wonderful thing to have in case that you already lost a tooth. So I strongly recommend you to keep that in mind. Consider this as one of those strong candidates to replace your teeth. What's the difference between this dental bridge and denture? Lots of my patients, when they come in, they talk about, oh, I have a bridge that I don't like. I never use them. It caused a lot of problem. When the patient used that bridge, I think they meant partial denture. So I usually ask them, is it removable or is it fixed? And voila, they told me, oh yeah, that's the piece that I take it in and out. So it means that people use the word bridge loosely without knowing the exact definition. Okay, so that brings to that question, what's the difference between a bridge and a denture? So a bridge is cemented permanently onto your teeth, whereas denture, whether full denture or partial denture, they are a removable piece. So this is a partial denture and this is a full denture. So, and this is a bridge. Okay, so make sure you understand and have these figure or pictures in mind when you use the term. So one more time, the bridge is cemented permanently and is fixed. You don't have to take it in and out. The denture is removable. You have to take them in and out. Okay, next, a bridge only replaces a section of your mouth or your arch where you have missing teeth there. Whereas with dentures, if you miss in the same arch, if you miss 2 or 3 teeth, one partial can definitely cover the whole thing. So you only need one partial for all the missing teeth. Whereas if you have a bridge, you need multiple bridges. Okay? Full denture is when all your teeth are gone. So you need one full denture. So I hope my explanation can help you differentiate so you can use the terminology to communicate with your dentist a lot better. What are the pros and cons of dental bridges? Okay, so dental bridge, once you have a bridge, you can chew again, you can speak, hopefully better pronunciate a little more clear, because when you speak with the empty space, the air can just come out into that space and make you pronounce a little differently, especially you missing front teeth. That definitely impinges your speech tremendously. Okay, so and the bridge can help you chew, so therefore it helps with the bite. Okay, but the most important thing that it helps is that it helps retaining the two anchoring teeth in the right position without shifting them. So one more time, imagine you don't have anything here and you don't do a bridge, the two teeth next door can shift in. The opposing teeth with gravity can come down, and the upper teeth here or the opposing teeth can bite in the wrong angle, making the lower or the opposing arch shifted or being the wrong position. So having the appropriate bite is extremely important, and the bridge can help make it happen. Cosmetically speaking, well, needless to say, you look a lot better. And again, another thing is if you don't have anything replacing that missing tooth there, your facial structure can sink in. I have some pictures that can demonstrate that when people lost a tooth, the gum and the bone shrink, the face all of a sudden sink in, make you look a lot older. I'm saying that from the standpoint of a woman. I definitely care a lot about how my face, my cheek, and my lip, I want them to look full. So a bridge can definitely give you that full look. All right, so how about the cons? What are the cons of the dental bridge? So with the dental bridge, you have to shape the adjacent teeth a little smaller so that you can put the bridge on top with, you can restore the original shape. So people question that, should I or did I just sacrifice the health of the adjacent teeth to support the bridge? Well, the word sacrifice depends on how you define the word sacrifice. But in my opinion, if you shape it, but then you can support the bridge, you can gain more pros as opposed to the cons. Not to mention the way that we shape your healthy teeth. It's not like we shape it to damage it. The shaping is minimal, just enough to meet all the criteria to support the bridge to make it last long or longer. So in my opinion, and when I advise my patient, I don't mind the cons, just to support a lot more pros. And the next thing is a bridge acts as a team. They all joined. So if something happened to one member of the team, the whole bridge comes down. The teeth underneath the bridge are still your live or to your natural teeth. So you can still have a high chance or a lot of chance to get cavity. So make sure you take very good care of them to avoid that chance. Make sure you brush and floss twice a day. Floss underneath the bridge. See the dentist as often as you are recommended to mitigate the risk. If the bridge is chipped or a piece of or one side or any corner of the bridge is chipped, unfortunately you have to replace the whole bridge. So that part of the cons of the bridge is something that you have to take into consideration. I still think it's well worth it with all the advantage that the bridge has to support or it has to offer. What are the alternative of doing the dental bridge? If I don't get the dental bridge, what other choices do I have? First, doing nothing. I spent a little bit, if not a lot of time, talking about doing nothing with no treatment. The two teeth next door will shift, the bite will be off, the gum will shrink. Of course, cosmetically speaking, you will not look as good. Your facial will shrink, and well, mind you, I don't know about your confidence, but the confidence may go down. So that's that. The next option is a partial denture. A partial denture is something I had shown you a little earlier. It's a removable piece. So lots of people don't like the inconvenience that the partial denture bring in. However, if you can overcome and practice with the partial, take good care of the partial, it can still be a reasonable option for you to choose. The speech in the partial denture will definitely be impinged. Certain pronunciation, being that this is in the upper arch, your tongue cannot roll all the way to the palate, you will sound a little bit different. Again, it will take some practice for you to get used to it. At the end of the day, having something is better than doing nothing. So having a partial, I would still vote for it more than leaving the tooth alone, okay? Next option is for you to do an implant. Implant is a piece of prosthesis that you can place into your jawbone. If you were to do an implant, it has many tremendous advantage. The first thing is that you don't have to touch the adjacent teeth. So in case people are concerned about the sacrificing the health of the adjacent teeth, then implant will be more suitable for those school of thoughts. The implant is also help holding your gum and your bone make them shrink less than if you even doing a bridge, because the bridge where the pontic, where the middle tooth is, you don't do anything to support the bone, so the bone will continue to be resorbed, to shrink, to recede. So that's that. Well, in terms of the cost, of course, doing nothing, no treatment, doesn't cost you a dime, but there are a lot more that you will lose: the chewability, convenience, etc. I don't want to go further, but because I don't support doing nothing. Secondly, the partial will probably be the least expensive, economical, reasonable choice, but you will pay back with the inconvenience. You can't speak, you can't chew, you might lose them, or you might have pain when the denture rubs or partial rubs on your gum. So the bridge will be the next level of treatment that I would strongly recommend. The cost will be more than the partial, and the implant will probably be the most costly out of all the options, but it gives the most advantage. Well, people say you pay for what you get. So this is exactly the case. How does dental bridge intertwine with gum disease? Does it help with gum disease? Well, here's the answer. With a bridge, we need the two adjacent teeth to support the bridge, right? So the health of these two adjacent teeth have to be strong. So in terms of the gum disease, we have to do an examination to see how much bone support, how healthy the gum and the bone of the two adjacent teeth are before you can start, or before we recommend that you can start with the bridge. So if you already had gum disease, I would recommend you to have the dentist take care of your gum disease first before they start the bridge. If you already have the bridge and then develop the gum disease after, make sure you continue to have it, either you start or you continue meticulously with your gum treatment program. The major part that you can do is brush and floss really well, come see the dentist more often. Okay, replacement of the bridge or losing the whole bridge is definitely not fun. I wouldn't recommend that. So take care of the bridge before you have to deal with any damages that happen. So gum disease is a big enemy or a problem that people with a bridge need to consider. So in short, the bridge doesn't help with the gum disease. Does it make your gum disease worse? It doesn't, because once you already have the bridge, you have to consider to spend a lot more time to take care of your bridge or your teeth underneath. If you don't have that kind of effort, or you're not willing to, or you didn't spend, or you don't spend enough time, effort to support have better oral hygiene to support the bridge, then I'm not sure how long your bridge will last. Okay, how long does a bridge last? A bridge should last you an average. I can throw an average number out between 5 to 15 years. Okay, first of all, with healthy condition of the adjacent teeth to start out with your good oral hygiene, with coming to the dentist often, so the dentist can advise you what you need to do. The bridge should last even longer. Okay, but well, we can only age, and as we age, things go downhill. So we can't do anything about it. So that's why I use the number 5 years, just to be on the precautious side. Also, most insurances out there are only willing to pay for the new bridge or crown every 5 years. So for some reason, we just use the number 5 years as a benchmark. But with proper care, I think that you should expect it to last longer. In our office, we provide an extra perk on the side. If you buy insurance for the bridge, you pay a little extra for the lab to give you the better material, and you can get the warranty. So if the bridge breaks in between that 5-year period before the insurance pay, we will be more than happy to replace your bridge at no cost. So make sure you come and ask whether us or your dentist if they have that program going on. What's the procedure of making the bridge or replace a bridge look like? So the first thing the dentist will do is to get you numb, get you comfortable. Then we will prepare the two adjacent teeth. Then we will pack the gum, pack a cord around the gum. We will take a record and send to the lab. And you will have a temporary bridge. So in between the 2 weeks, make sure you take good care of the temporary. Don't eat, don't chew on it really with something hard or sticky. After 2 weeks, we will replace the temporary with the permanent one. We will cement that in permanently, and that's how it is. Is it painful? Not really, because we'll make sure that you're numbed the whole time while you're in the procedure, in the chair, getting the procedure done. Afterwards, we will give you some pain medication, and well, after the permanent bridge is put on, you might feel a little sensitivity for a short amount of time, a little uncomfortable, a little discomfort because you never had it before. You need to get a little time to get used to it, and after that, you should be able to chew pretty much anything that you like. Especially when you use a strong material nowadays, you should be able to use it almost as close to your natural teeth, as close as if you chew on your natural teeth. How can I care for my dental bridge? So brush 2 times a day, floss after meals, come see the dentist often, constantly be aware that you have a bridge in there. I would strongly recommend you to open your mouth, use a mirror to see if there's anything that's stuck underneath, anything at all that is peculiar, and bring it to your dentist's attention as early as possible. But it's a great idea to get a water pick. They sell it at Costco for a lot less than any other place. And yep, use a water pick and take good care of your teeth, do good oral hygiene, then your bridge should last for a long time. How much does the bridge cost? So the bridge when we talk about a bridge, we talk about how many units does it involve. So you're missing 1 tooth and you need 2 adjacent teeth to carry the bridge, then the bridge now is a 3-unit bridge. So vice versa, if you miss 2 teeth in between and you use 2 anchoring teeth, so your bridge now is a 4-unit bridge. So the fee in general, you count as how much is it per unit, and you times it by how many units that your bridge has. So that's the simple math, okay? In general, any crown, any unit costs anywhere between 1,000 to 1,500 plus or minus, depend on each location, each insurance. Be careful, your insurance is very tricky in terms of covering for the bridge. They have so many little red tape, little fine print, that if you miss your teeth before you have their coverage, so it's the same as pre-existing condition, most of the time they don't cover. So in our office, we usually explain and discuss with you very carefully with the cost of the bridge before we start. We want to be very clear and transparent with all our patients. However, just to make it simple, when it comes to a bridge, maybe it's wiser for you to consider pay as if you're paying for the bridge out of your own pocket. And if the insurance happen to help you cover, then it's a bonus. So that's the better mentality coming in before you start a bridge. I hope I have cleared up some of your concerns. If you have any further questions, feel free to give us a call. Our number is 702-456-0056. Thank you.